Today I'm going to demonstrate to you on how to insert an IV. First, to begin, to explain to you why an IV. Well, when a person is hospitalized, a lot of times the doctors want an IV inserted for either blood transfusions, medication administration, or due to the fact that the patient could be dehydrated, so they need them for IV fluids. So a lot of the times, the majority of the people that are hospitalized are needing an IV inserted for those reasons. So today I'm going to demonstrate to you on how you insert an IV. To begin with, you're going to need your supplies. And I have a little IV start kit that I have open here a little bit. And usually in the IV start kits, a tourniquet is in there, but if not, you need to grab a tourniquet. And inside the IV start kit, you have a Tegaderm to place on top of your needle, an alcohol swab, some 2x2s in case the patient starts to bleed, and you can use that. And oops, there it goes. And usually you have like a little tube or a little thing that you pop these, and it has the ChloraPrep that you use to clean the area that you're going to start the IV on. This is also a Tegaderm, but that was separate. You're also going to need whatever medications that you're planning on giving. If you're planning on hanging a medication on the patient after the IV. I usually would like to prep the medication prior to starting the IV. And to do that, you're going to need gloves as well. Usually, to do that, you want to make sure that you got your fluids or medication or whatever it is you're going to administer the patient prep. So here's dextrose, 5%. And it comes with a little plastic thing here in the bottom that you usually pull off. And when you pull that off, and this little port here is where you're going to spike the medication or the fluids. And this is your spike here, and this is a tubing that connects here from this little port here that goes connected to the IV hub once you connect it. So what you do is you open that, you're going to prep your medication, you're going to spike the bag, right? And then you're going to let it free flow down. And you got this little thing to kind of stop the liquid from falling through, so you use that. It goes down. And you want to let it flow all the way down to the right, to the end, and then you're going to stop it. And you use this to control it. And then once you get there, you got that prepped. Of course, I don't have a pole, but usually you hang it. You have it ready to go once that IV is started on the patient. Okay, so usually, yes, this is what I usually, some people don't prep this till after they start the IV, but I like to have, if I'm going to have to hang a medication right after I start the IV, then usually I like to have the medication prepped and ready to go. That way I can just connect it to the patient once I've started the IV. Okay, and you want to make sure that once you get started, you have all your stuff. You got your Tegaderm, you got your ChloraPrep, you got your tourniquet, and you got your catheters. There's many different sizes in catheters, and depending on the patient and what kind of veins that they have, is usually what's appropriate to use, which catheter you can use, because there's some catheters that are pretty large and you got some patients who have pretty small veins. So you don't want to use something like that because the vein is going to blow. You want to use one that's appropriate for the patient. You got many different sizes from large to small. So whatever is appropriate for the patient, and usually when you look at them, you can pretty much tell. Look at the patient's vein, you can kind of tell. I'm going to use this cucumber as my arm for my vein to show you how to insert an IV. Okay, I like to have my stuff prepped in here, ready to go, and I also have some tape because you're going to need that once you connect it, the needle to hold it down on the arm. Okay, so I'm going to use a 20 gauge needle. Okay, we're going to use a 20 gauge needle. I'm going to have that there. Okay. And you're going to assess the patient and look at the arm. You see, kind of have an idea of where there is a good vein. And once you get that, you want to put the tourniquet. The tourniquet, what it does is applies pressure there, and it allows the vein to pop up a little bit, make it easier for you to insert the needle. And you kind of got to go over a loop, little snug, but not too crazy tight, because it can cause pain to the patient. And also, too, when it's too tight and you insert a needle, a lot of times it can actually blow. So once you have it on there, and you're going to assess the patient for the vein, and once you do find a good vein, you want to top the skin where that vein is and kind of keep a good eye where that is. Then you're going to get your ChloraPrep. And these little things pop. I don't know if I really have popped this before, but these little things usually pop, and there's different styles of the ChloraPrep that they come in. There's some that are a little plastic, a lot easier than this. And then once that pops and you got the ChloraPrep coming out of this little cushion here on the, you're going to start cleaning around the area where the vein is, and just going around in circular motions for a good 30 seconds. Usually I like to go for like a good 30 seconds to get that little area clean. And it actually stimulates that vein to kind of help pop it out a little bit more. And once that happens, you allow it, wait a little bit, allow it to dry. Then you're going to get your needle here. And usually when you're going to start inserting, of course, you're going to taut the skin. And you're going to want to angle it at least 10 to 15, at a 10 to 15 angle to where the vein is. So once you go in, and always remember that the bevel has to be up. And then once you go in 10 to 15 into the vein, you're going to see a flashback. Once you see a flashback of the blood, then you are going to advance the needle a little bit more. Then you're going, once you advance the needle a little bit more, then you're going to start pulling the needle out and advancing the catheter. You advance the catheter all the way in and you remove the needle. Oops, sorry. The cucumber's kind of hard. Then usually what I do is apply pressure there. I remove the tourniquet. Then I put the tape there continuously to apply pressure. These gloves are a little too big. I don't have any mediums. This is all I had here at the house because my husband wears large gloves and I wear smaller ones. And then usually this I'll have pressed. And then once I have that, I'll connect it. Usually a lot of times I won't connect the medication immediately. I'll flush it with saline, because the reason why you want to do that, you want to flush it a little bit with saline. Make sure you get blood return. You want to draw back a little bit. Make sure you got blood to be positive that the needle is in the vein. And once that you have it secured, you put the tape, it's secured. And then after that, then you put more tape. Whatever you see fit. It's kind of hard there. Usually I'll put tape underneath here, the hub there. It's a little thicker than what I like, but you go over, and a lot of times I like to put the Tegaderm on top of here. And the Tegaderm keeps it all in place. Doesn't look as neat as I'd like it to, but then again, I don't have a real arm, and this is a cucumber. But anyway, once it's held in place, you got it there, it's pretty snug, and the medication is hanging, and then you can, you always want to date and initial the IV, wherever it is you have the Tegaderm, you can mark it with a Sharpie. That way they know when the IV was inserted, who inserted it, and a lot of times I like to put the time and when was inserted. Because usually IVs you don't want to keep no longer than 72 hours, but then again you follow the protocol of whichever hospital or clinic or facility it is that you work for and what their protocol is, but usually it's 72 hours. And that's how you insert an IV.